If you're on Medicare or getting close to turning 65, listen very carefully because the changes coming in 2026 will affect almost every American senior. And I'm not talking about small adjustments or typical yearly updates. What's coming in 2026 includes some of the biggest Medicare shifts we've seen in more than a decade, and most people still don't know what's about to happen. But the sooner you prepare, the more money you can save, the fewer surprises you'll face, and the easier your healthcare decisions will be. So stay with me all the way through this video, because if you're only half informed about these changes, you'll end up paying more or losing benefits you could have kept. Before we get into the details, let me start with the most important point. Medicare in 2026 is not going to look exactly like Medicare in 2025. Premiums are expected to shift, drug costs are expected to drop in some areas and rise in others. Coverage rules will be adjusted, more plans are entering certain states while others are pulling out, and the government has already announced several policy changes that will take effect in the first quarter of the year. If you've been thinking you can just renew your current plan without reviewing anything, that could end up being a big mistake. Now I want to begin with something most people have only heard in bits and pieces. In 2026, several major drug pricing reforms that were approved earlier are scheduled to fully kick in. And while that might sound like good news, it's important to understand that pharmacies, plans, and manufacturers all adjust their pricing structures in response. What that means for you is that your out-of-pocket costs could change even if you keep the exact same prescriptions and the exact same Medicare plan. Some seniors will see lower costs for their most expensive medications, especially those used for chronic conditions like heart disease, diabetes, or autoimmune disorders. But others may see increases in less talked about categories, and if you're not paying close attention during your annual enrollment period, you could end up in a plan that is no longer the most affordable for your situation. One of the biggest shifts coming in at 2026 involves Medicare Part D. Many beneficiaries don't realize that the structure of the Part D benefit is changing in phases, and 2026 is the next major step. The yearly out-of-pocket maximum for prescription drugs will be different, and for many seniors, this could be the most financially important change of the year. If you rely on brand-name medications or combination therapies, the amount you pay before reaching your cap will be different, and the percentage of your medication costs covered during each phase of your Part D plan will be adjusted. Again, this is why staying informed matters. Most people never read the fine print on their plan changes, and that's exactly how unnecessary expenses pile up. Another change you need to be aware of involves Medicare Advantage plans. Every single year, these plans adjust their premiums, their provider networks, their hospital contracts, and their extra benefits. But in 2026, a higher number of plans are expected to restructure their supplemental benefits. That means dental, vision, hearing, transportation, groceries, utilities support, and fitness benefits may look noticeably different. Some plans will increase these extras, especially in competitive states like Florida, Texas, California, Arizona, and the Carolinas. Other plans will scale them back due to budget adjustments. If you're someone who relies heavily on dental or hearing benefits, or if you depend on transportation to medical appointments, you need to pay extra attention this year. Now, let's talk about something that affects nearly every senior in America: Medicare premiums and deductibles. While the final numbers for 2026 are usually announced closer to the end of the year, early projections and policy signals indicate that there will be real adjustments. Many seniors assume premiums always go up, but that's not necessarily true. In some years, premiums stay flat or even decrease a little. However, deductibles, coinsurance amounts, and copays often shift in ways that directly impact your out-of-pocket spending. If your budget is tight or you're on a fixed income, these changes can make a noticeable difference in your monthly expenses. This brings me to something most seniors overlook until it becomes a problem: provider networks. In 2026, many Medicare Advantage plans will update their provider networks, meaning that doctors who were in-network this year might not be next year, and hospitals that were fully covered could be reclassified. If you have a primary care physician you trust, or if you're in regular treatment with a specialist, you need to make sure they remain in-network. The number of seniors who discover too late that their doctor no longer accepts their Medicare Advantage plan is much higher than you might think, and avoiding that situation is as simple as staying informed. Now here's something encouraging. In 2026, we're expecting more digital benefits, more telehealth options, and more chronic care management support across both Medicare Advantage and Original Medicare. Seniors with conditions like diabetes, COPD, heart disease, kidney disease, and arthritis may see expanded support programs, including remote monitoring and nurse coaching. These services can make a real difference in your long-term health, especially if mobility is an issue or if regular office visits are difficult. And while many of these benefits expanded during the pandemic, 2026 is the first year where many providers will permanently integrate them into their Medicare offerings, which is a great step forward. Now I want to shift to something equally important: scams and misinformation. Whenever major Medicare changes take place, scammers take advantage. They pretend to be Medicare representatives, insurance agents, or pharmacy partners, and they use fear or confusion to trick seniors into giving personal information. In 2026, you will almost certainly see an increase in phone calls, mailers, and online ads claiming to explain the new changes. But here's the truth. Medicare will never call you and ask for your Social Security number, your bank information, or your Medicare card. If someone contacts you claiming you need to update your information because of the new 2026 Medicare rules, hang up immediately. Scammers always target seniors most heavily in years when Medicare rules change, and unfortunately, many people fall for it. Let's turn now to a topic that affects a large percentage of older adults: Medigap, also known as Medicare Supplement plans. The price of Medigap tends to adjust each year due to age rating, inflation, and policy changes. In 2026, premiums in several states are expected to rise more sharply than usual, but that doesn't mean you're stuck. You may be able to shop for a better price depending on your state's rules. If you're in a state with year-round guaranteed issue opportunities, or if your state has special birthday or anniversary rules, you may be able to switch Medigap plans without medical underwriting. Many seniors have no idea they can do this, and they end up paying far more than they need to. Medigap can be a powerful way to control your long-term costs, especially if you want predictable coverage and the freedom to see any doctor who accepts Medicare. Now, I want to pause here and give you a quick reminder. If you're finding this information helpful and you want to stay ahead of Medicare changes before they affect your wallet or your health, make sure you subscribe to Medicare Mentor. This channel focuses on helping American seniors save money, avoid mistakes, and make clear decisions in a system that can feel confusing. If you've ever felt overwhelmed by Medicare's rules, this is your home. Hit that subscribe button so you don't miss the updates that could help you save hundreds or even thousands of dollars a year. Let's continue, because there's more you need to know about the 2026 changes. One significant shift coming next year involves insulin and certain high-cost medications. The $35 monthly insulin cap has already helped many older Americans, but 2026 will bring adjustments to how insulin pricing is handled within certain plans. Some plans may tighten their formularies, meaning they may cover fewer versions of insulin or require prior authorization for certain types. If you rely on insulin, you need to check your plan's formulary carefully during the enrollment period. Never assume a medication you're taking this year will automatically be covered next year in exactly the same way. Another area where changes are expected involves home health services. As the senior population continues to grow and more people prefer to age in place rather than move into assisted living facilities, Medicare is adjusting how home health agencies are reimbursed. These changes can affect which agencies operate in your area, how quickly you can receive home health services, and what type of care is available. For seniors recovering from surgery, managing chronic conditions, or needing help with mobility, home health is a lifeline. Understanding your 2026 benefits will help ensure you don't face delays when you need help the most. One more thing that deserves attention is how Medicare handles preventive care. Preventive screenings, vaccinations, and wellness visits may undergo slight adjustments in coverage rules or reimbursement rates. These changes usually benefit seniors, but only if you actually use them. Many seniors skip preventive care because they think going to the doctor is only necessary when something is wrong. But staying ahead of issues is one of the best ways to stay healthy, avoid hospitalization, and reduce long-term healthcare costs. In 2026, you'll likely see more emphasis on preventive care, and taking advantage of these services can help you stay independent longer. Now let's talk about something that might surprise you. Technology is playing a bigger role in Medicare than ever before. Devices that monitor heart rhythm, blood sugar, blood pressure, and sleep patterns are becoming more common, and Medicare plans in 2026 may offer new benefits related to remote monitoring. Some Medicare Advantage plans will also provide enhanced support programs for fall prevention, mobility improvement, and caregiver coaching. With more seniors choosing to live independently, these tools can be incredibly helpful. As we get closer to the end of this video, I want to emphasize one thing. Medicare is not something you set and forget. It changes every year, and 2026 will bring some of the biggest adjustments we've seen in recent years. Whether you're already enrolled or preparing to enroll soon, staying informed can protect your finances and preserve your peace of mind. The truth is, most seniors don't realize how much money they could save simply by reviewing their plan each year and understanding what's new. A few minutes of attention can prevent thousands of dollars in unexpected costs. If you've watched this far, that tells me something important. You're the kind of person who wants to take control of your healthcare instead of letting Medicare's complicated rules take control of you. And that's exactly why I invite you again to subscribe to Medicare Mentor. This channel exists to guide you, step by step, through every update, every benefit, and every opportunity to save money. You're not alone in this. The system is complicated, but together we can make it simple. As we move into 2026, stay alert, stay informed, and stay protected. Review your plan, talk to your doctor, update your medication list, and double-check your benefits. The changes coming next year are significant, but with the right knowledge and preparation, you can navigate them smoothly and confidently. Thank you for spending your time with me today. I'm here to help you make sense of Medicare, one video at a time. Stay well, stay proactive, and I'll see you in the next one.